have so many enormous clinic days. I mean, every day you look in my book here, these are all patients that I have seen on those days. 41, 48, 47. The principal problem that we confront in this clinic is chronic pain. It's basically a pain clinic. Well, take a seat there, young lady. Now, Tunde, you're dealing with irritable bowel syndrome, which is a weird disease. How does a cardiac surgeon end up getting involved with cannabis? And that is not an easy question to answer. I'm losing my vision. And when you're a heart surgeon, the worst thing that can happen to you is to lose your vision. So that's really one of the things that encouraged me to go into this thing.
I vaporize a little bit in the morning before I go to work. Sometimes if I've had a hard day and I've sat in a chair too long, and I will use it in the smoking area at work. And then of course at night.
Yes.
But I don't smoke all day long.
Now, there are doctors who know one hell of a lot more about cannabis than I do. You know, there are a lot of people working in this clinic that know more about which strains are acceptable for what things. They know more about that than I do. But I know that when somebody is a candidate for the use of cannabis, I know that when they are and when they are not.
Well, for the IBS, they gave me 4 different kinds of antidepressants, and they made me feel like I wasn't me. So when I got off of those and I started marijuana, I felt like me and I could move around, and you know, it still hurts. I mean, it doesn't completely dissolve the pain, but I could be an active person in society. I love Dr. Orvald. He asks you a bunch of questions, marks some stuff on the paperwork, and then signs it.
It causes mainly abdominal discomforts. And by using cannabis, and either orally or by inhaling the vapor, you can help to control that discomfort. One of the problems that we have today in medicine is excessive use of narcotics and opiates, which has escalated over the past few years, and those few years and that it has become such a severe problem are the years that I have recently spent here, because I see it every single day. I don't criticize the patients, I criticize the doctors, because the doctors are the guys who are handing out narcotics and opiates like they're candy. This is not the way medicine should be practiced. I am here to take care of patients. That's what I've done my whole life. And I will do that for as long as I can. But you see how many I do see here: 48, 38, 37, 47, 45. Mamma mia, that's enough.